Hello, and welcome to Evidence Mastery. I'm your host, Dr. Masoud Tusi. Today, we're taking a deep dive into one of the most comprehensive health data systems on the planet, the French National Health Data System, also known as the SNDS. So let's just jump right in with a single, frankly staggering number, 99%. What does that mean? Well, it means this system covers nearly the entire French population. We're talking about a longitudinal health record for over 67 million people. That makes it an unbelievably powerful resource for public health and research. So what is it exactly? The SNDS, or in French, the Système National des Données de Santé, is what we call a medico-administrative database. It pulls together a huge amount of data about healthcare consumption from all across France. Now, a system this massive wasn't built overnight. It's really the product of a 2-decade evolution. It started way back in 1999 with a predecessor system called SNRIM. Then in 2016, the modern SNDS was officially established by law. And more recently, in 2019, the Health Data Hub was set up to make it easier for researchers to access and use all this valuable information. All right, so let's pop the hood and take a look at the core components that actually make up this gigantic data set. The whole thing is really built on 3 foundational pillars. You've got the health insurance reimbursement data, then you have detailed hospitalization records, and finally, the National Registry for the Medical Causes of Death. You put those 3 together and you get a nearly complete picture of a patient's entire journey through the healthcare system. The first and biggest component is the DCIR. You can think of this as the system's backbone. It captures every single reimbursed healthcare interaction. I mean, everything from a simple doctor's visit to a filled prescription. Okay, this diagram might look a little complex, but the really interesting thing here is how the DCIR acts as a central hub. Right at the core, you have a claims table, and that links out to these incredibly detailed tables for things like pharmacy, biology, and medical devices. It's this structure that lets researchers do some really specific granular analysis. Next up, we have the PMSI. This database gives us that detailed look at what's happening inside the hospital walls. It covers stays in both public and private hospitals, and it records all the diagnoses, procedures, and other key events that happen during an inpatient visit. And finally, the CPDC completes the picture with mortality data. What's so crucial here is that this cause of death information can be linked back to a person's entire healthcare history in the SNDS. For researchers, that allows for some really powerful endpoint analysis. So, with all of this incredibly sensitive data, the next logical question has to be, how do you get access to it? And that brings us to the highly regulated gateway for research. Access is definitely not a free-for-all. It's very strictly controlled, and it's split into 2 main pathways. There's permanent access, which is for state agencies that have ongoing public health missions. Then for pretty much everyone else, public and private researchers, access is granted on a project-by-project basis and only for studies that are deemed to be in the public interest. The standard path for a project is a really rigorous, multi-stage process. It all starts with a submission to the Health Data Hub. From there, it goes to a scientific and ethical review. And finally, the French Data Protection Authority, CNIL, gives the final okay before a pseudonymized data extract is made available for analysis. And here's the crucial point. This whole process is built around security. All of the data processing has to happen within a certified, secure environment that's designed from the ground up to protect patient anonymity every single step of the way. So now let's get to the exciting part. How is this incredible resource actually being used to power scientific discovery in the real world? Well, the SNDS has become an absolutely invaluable tool for pharmacoepidemiology. And as this quote really highlights, its power comes from its real-world nature. It lets researchers study the effects of drugs in populations like children, or pregnant women, or the elderly. You know, the very groups that are often underrepresented in traditional clinical trials. And this chart breaks down the main areas of research. A systematic review shows that the vast majority of studies, about 65%, are looking at drug utilization, how medicines are actually being used. That's followed by drug safety evaluations, and then a smaller but growing number of studies are looking at real-world drug effectiveness. But, like any data source, the SNDS has its limitations, and understanding those limitations is the key to unlocking its full potential. This brings us to the value of something called data enrichment. So just think for a second about where this data comes from. Reimbursement claims, hospital administration. What's the key piece of information that might be missing from all of that?
The answer, as this study points out so well, is that detailed clinical information. Things like specific lab results, or cancer staging data like Gleason scores, or even lifestyle factors. Those things just aren't typically captured in administrative claims data.
And the solution is data enrichment. This is where it gets really clever. Researchers can overcome these limitations by linking the SNDS to other, more clinically focused data sources. We're talking about linking to population cohorts, pathology labs, emergency room records, even clinical trial data, to create a much richer, more complete data set for analysis. So in summary, it's pretty clear that the SNDS is so much more than just a static database. It's really a dynamic, evolving ecosystem, and it serves as a true cornerstone of evidence-based medicine and public health surveillance in France. And all of this leaves us with a really critical question for the future. As these massive national-level databases become more common and more sophisticated, how are they going to fundamentally transform the way we make public health decisions and practice medicine, not just in France, but on a global scale? Thank you for joining this Evidence Mastery Explainer. If you'd like to dive deeper into these topics, my book, Real-World Data, Sources and Solutions, explores many of them in much greater detail. It will be available on Amazon.com in December 2026. Thanks again for watching.